Inserting a peripheral IV is one of the most feared procedures for patients in the hospital, and it happens on a regular basis. So we don't want to put our patients through it more than we have to. So we're going to talk about maintaining that IV when we're not using it on a regular basis. It's called a saline lock right after this. Okay, so welcome back. We're talking about saline locks and how to maintain our IV in between uses when they're being used on an intermittent basis. So let's begin doing our two-patient identification. We have Mr. Alex Tanner, born in 1950. I'm going to move then to the dressing and confirm that it is dated within my agency's policy and that the edges of that dressing have not lifted up. Moving on to the catheter itself, I want to check the size to make sure it is as documented, and then look at the site, specifically looking for erythema, infiltration, and asking the patient if there's any pain. Following the cathetron, making sure the clamp is on and I have a neutral connector applied. Next, we're going to gather our equipment. I will need either a 3 or 10 cc of normal saline, an alcohol swab, and then some sanitizer to complete hand hygiene before I start. The most important thing here is to scrub the hub for 15 seconds. Now before I get my swab ready, I'm going to get my saline syringe ready. I'm going to break the seal by pulling down and prime out the air that's in the top there. Gathering the alcohol swab, I'm now going to maintain the tip of my syringe as sterile while I scrub the hub for at least 15 seconds. It's important to use friction as you scrub the hub to help remove any foreign materials and ensure that we have a sterile surface. Once you're done scrubbing the hub, we're going to let that air dry for a few seconds. And then we can go ahead and attach our syringe into the neutral connector. You just push and twist. Perfect. Now we're going to open up the clamp and do a pulsating pressure and instill 3 mils or 3 cc's of normal saline using a pulsating pressure. As you get near the end of the 3 mils, you can clamp off the catheter at the same time as you are pushing in the 3 cc's. This creates positive pressure in the lumen and helps to prevent clots from forming. Now, when using a neutral connector like this, you do not need to clamp while pushing. You can simply disconnect and then put the clamp on after. And that's it. My saline lock is patent. I now know that if I need to administer medications, whether a scheduled intermittent or a rescue medication, I have a patent line. Until next time, make it a great day.